Okay, there are several ways now that several different levels that consumers have involved when it comes to the public health information needs. And Ferguson has outlined 10 levels in which online healthcare consumers, or e-patients as we call them, can access health related information. Level 1 is the search for health information. Consumers engage in a pretty much a search and rescue. For their newly diagnosed diseases, they go online, they look up their symptoms, and they come up with these different diagnoses online. Level 2 is exchange email with family members and friends. Consumers use email to communicate with loved ones about their health issues. After they've, of course, looked it up online. Level 3 is they seek guidance for the online patient helpers. When confronting new healthcare issues, consumers may seek out and communicate online with another patient who pretty much has experienced the same thing. Pretty much like those therapeutic groups that are formed online with similar to people with similar healthcare issues. I know my friend; she's a part of a lupus support group. Level 4, they participate in online support groups. Like I just said, they participate in online support groups and exchange information and different remedies and different coping skills to deal with their illnesses that online. Level 5, they join with other online consumers and they research their shared concerns. Support groups organize themselves into online work groups and they examine healthcare literature and then exchange concerns at that time. Level 6, they use online medical guidance systems. Online healthcare consumers can access websites where they can enter the names of all the drugs they're currently taking and all the information and obtain all the information possible on different drug interactions. There are sites where patients can answer a series of healthcare profile questions and receive a list of possible risk factors. So that's level 6. Level 7 is they interact with volunteer or online health professionals where they pretty much can email or instant message volunteer health professionals to get immediate answers for their illness. Level 8, they use paid services of online medical advice and consultants. Some consumers use online only services now offered by healthcare practitioners where they pay to get that information or second opinion or just seek advice from different physicians, which is pretty good because it gives them a second opinion without going through the hassle of making appointments and researching and doing all of that. So that's pretty handy. Level 9, they engage in electronic conversations with their online clinicians. So that's also good. It's immediate information. And level 10, they receive one-way electronic messages from their clinicians. Some health professionals use information technology to send their patients unrequested messages that are not interactive. Instead, they provide targeted behavioral change and patient education material of the doctor's choosing, noted for effectiveness of the pushed messages. So that's always handy to receive information from your current physician. One-way information where they pretty much what you call push messages, which automatically gets pushed out to the consumer. So those are the different levels that consumers are now using consumer healthcare information to help with their personal healthcare needs. Thank you.